Hi, Dr. Magaziner here again for another medical moment. I want to talk about a study that was just published by the government. And after 6 decades of a continuous rise in life expectancy of Americans, we're seeing for the first time since 2017 a decline in life expectancy. Whereas up until recently, the average American was estimated to live to be about 78.9 years of age. Now, for the first time in 6 decades, we're seeing a decline to about 78.6 years of expectancy. So this is the first time decline in nearly 6 decades. What they concluded was because of the opioids, drug abuse, alcohol abuse, suicides, and increase in liver disease and liver failure, that is what's in part causing the decline in life expectancy. So our lifespan is now, for the first time, once again, is going down. But here's what I want to talk about today I think is so important that they didn't bring up, that I'd like to bring up. And that is our lifespan, what our goal should be. If we take a look, and we look at what's called the quality of life, QOL, versus our age. For the human beings, we're born at some point, and we're pretty healthy most of our life by age, let's say, 15 or 20 years old. And what happens, we hit age 50, 60, 70, 80, whatever it might be, and we start our decline with our quality of life, our quality. And so the average American spends anywhere from 10 to 15 years of his or her last part of life in a steady decline. And this is where people complain of feeling tired, fatigued, high blood pressure, diabetes, obesity, cancer, heart disease, high blood pressure, all the things we hear about, and frequently they're on medications and they have a steady decline in their quality of health. What I'd like to see, if we could, should be the goal that I want all of you to think about as you go into the new year soon, is we want to try to what's called rectangularize this curve. And we really should, our goal should be to live a long quality of life, and we want that quality of life to continue until a very ripe age. Oops. You can see I'm not the greatest artist. Hopefully I'm a better doctor than I am artist. But anyhow, what we want to do is we want to try to rectangularize this, we call it this death curve, and we're hoping that we're healthy to a ripe old age, 78, or hopefully much older, 88, 98. We have a lot of patients now in our 90s, in their 90s. And then someday we don't wake up when we're, let's say, 90 to 100 years of age. 95, 100. And this way, our quality of life, our lifespan, begins to equal our health span. And that's what I really want to bring out today, that we want these two to be equal. And unfortunately, the reality is, in our society today, they're not equal. And once again, we spend about the last 10 to 15 years of our life battling disease and on chronic medications and have chronic problems and not feeling well and not having the quality of life that we're searching for. So keep in mind, by following good lifestyle modifications and good diet, exercise, meditation, relaxation, all the environmental controls we talk about in my office, meaning stay away from the junk, the chemicals as best as possible, and eating more organic food, eating more fruits and vegetables and more plants, we hopefully can extend this part of the curve and make it to look like that. So thanks for listening. Have a great weekend and stay well.